Hello, I'm Devin Gianetti, and thank you for joining today's Cuyahoga County and Board of Health press briefing. Today, we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. As usual, we will hear from our county leaders, then have some time at the end for questions. With that, we will begin with County Executive Budish.
Thank you, Devin. Hello, everybody. I'd like to start off, as usual, with a sincere thanks to our County Board of Health Director, Terry Allen, Jana Rush, and all the staff who are working so hard for all of us. They continue to be very busy testing and contact tracing. New cases are showing little sign of slowing down. And now we have the new, more infectious variant of COVID out there too. Even though you're going to hear some good news today about the vaccines and the rollout, it's definitely not the time to let our guards down. It's the opposite, in fact. Imagine if you decided it was okay to visit friends and family without masks for just a little bit because you miss them so much. Or maybe you decided it would be okay just this once to go out with your friends and grab a few beers. I know we all want to do these things. But imagine if you got COVID just days before getting the vaccine. Vaccine's not a cure. It would be terrible. Don't let down. As I've said before, there's light at the end of the tunnel. We just have to continue to be patient and alert. Now, I know there's a lot of urgency around getting the vaccine, and it's understandable. We all want this to be over, and we want to know that our loved ones are safe and that we can be safe. But as this pandemic showed just how interconnected we are, each decision we make does have an impact on the people around you. So does the solution require that we respect each other. We first need to get our frontline workers safe. Then we need to make sure our elders are safe, people in nursing homes are safe, and those who suffer from chronic illnesses and conditions are safe, because they're the ones dying at higher rates. And it's also important to remember a couple of things with the vaccine. The supply is coming from the federal government. It is very limited. The state is making the decisions as to how and when the vaccine is getting distributed. And these things change. There's a new administration in the White House, and they have a different approach. So we're all staying vigilant, and we'll continue to update you as we learn more. We'll also change things up if there's any way that we can increase the pace of the inoculations. I want to get through this just as badly as all of you do. Here's where things stand right now. Beginning this week, people 80 years old and up became eligible for the COVID vaccines. Next week, it's 75-year-olds. Following week, 70-year-olds. And then February 8th, anyone 65 and older is eligible. But even if you're eligible, that doesn't mean that you'll be able to get a shot. Supplies remain way too limited. Some states are taking a centralized approach. For example, Los Angeles is inoculating people at Dodger Stadium. Other states have taken a very decentralized approach, dividing the supply to lots of different locations. Ohio opted for the decentralized approach, sending the vaccines to 800 different providers around the state, instead of to just a few central locations. In Cuyahoga County, there are about 90 different providers, hospitals, clinics, pharmacies, and others. They're getting vaccines, each of them. The idea is that it's easier for people to get to places near them instead of having to figure out how to get to one central location. But with very small amounts, each location will only have relatively few doses, which means that they're likely to run out quickly. What's this mean to you? Cleveland.com described the situation, and I'm quoting, as a nightmare in the making. They went on to ask, does that mean very elderly Ohioans driving around in the snow trying to locate a provider with vaccines and no lines? endless holds on the telephone, short-staffed providers overwhelmed by the logistics of scheduling vaccinations when doses are insufficient and future supplies are uncertain. Those are real concerns. We want to try to avoid this nightmarish vision. So we've partnered with United Way's 211 program to provide a central number for you to call for the vaccine information you need. Pending approval by our Board of Control, we're funding the hiring and training of 15 additional 211 staff to take your calls during business hours. When you call, you'll be told who's in the 1A or 1B priority groups for vaccinations, and you'll be asked if you're in there. If the answer is no, then you'll be told you're not eligible at this time, and you'll be transferred to either the City of Cleveland or the Cuyahoga County Board of Health, where you can register on a wait list to be called when you do qualify. If your answer is yes, that you do qualify, that you are eligible, then you'll be asked which hospital, if any, you're affiliated with, and then you'll be given specific information as to how that system is registering people, and you'll be transferred to the sign-up line for that hospital. That way, you can register directly with the hospital. If you don't have a hospital provider, then you'll be directed to an appropriate family qualified health clinic, your primary care doctor, or the nearest and most appropriate pharmacy or other location where the vaccine is available. These locations may change weekly as the state continues to roll out additional vaccines. In order to efficiently navigate you to the best location for you, United Way's 211 will be using a county GIS application to locate the nearest locations based on weekly data provided by the state of Ohio. We know that this whole process is frustrating and it's confusing, and we're working to make this as simple as we possibly can. 211 is a trusted information source, and it can assist you whether you have access to a computer to sign up or not. If you do have access to a computer or have someone, maybe a grandchild, who can help you, you can go to cuyahogacounty.us/vax and get information on whether or not you're eligible for a vaccine, where to get one, and information on myths versus facts around the vaccine, because we know there are some crazy stories out there. The webpage is live now. The 211 line with the additional staff will go live on Monday next week. So don't call 211 right now. Don't call it today for this purpose. Please wait until Monday. And in the coming weeks, we'll be sending out a letter to all Cuyahoga County seniors to help them understand how to get the vaccine and where to register. I'd like to thank United Way and United Way CEO Augie Napoli for their quick response when I reached out and asked if 211 could step up and help. United Way is a valued partner to me and to the county in so many things, and I appreciate their support. I know that if I need help, I can call on Augie and United Way, and they'll be there, just as they are for all of us. So thank you, Augie. I'd also like to thank Council President Purnell Jones and the entire County Council for all their great support during this pandemic. Their actions have helped save lives. And now I'll turn it over to Terry Allen.
Thank you very much, Executive Budish, for your leadership and support. We're glad to hear that 211 will be joining us, and we appreciate your support and support of County Council in moving that forward. We heard from MetroHealth just a few days ago that in the work they've been doing so far, that 80% of those over 80 do better with a phone call than they do with trying to access the web. And so I think it's a great resource. It'll help to make it easier for those that want to get vaccinated. And it's a great addition to the range of supports in the community. So thank you for your support for that. So last week, Cuyahoga County joined other urban counties across Ohio to extend our stay-at-home advisory until January 31st, amid the continued high COVID-19 case numbers in our community. While our numbers have slightly declined, they remain about 6 times the CDC threshold for a high transmission in Cuyahoga County. And Governor DeWine recently announced that he intends to extend the statewide curfew because cases are still not very high in the state of Ohio. Consequently, it's clear that extending the stay-at-home advisory here and in other urban counties is warranted. So we'll continue to review the data, the decisions from the governor relative to the statewide curfew extension, and continue to work in collaboration with our urban county partners in making any future decisions about the advisory. As of today, we've vaccinated approximately 6,000 people, and we've utilized 80% of our first dose vaccine that we've received. With our activity scheduled this weekend, which includes a large pod or point of dispensing of about 1,000 people, as well as some mobile groups that are working in the developmentally disabled group homes, we'll vaccinate another 1,300 people by close of day Sunday. And we'll have utilized more than 95% of our first doses that we've received to date from the state. So we're glad to be receiving vaccine and very quickly getting it in arms and doing the best we can to try and protect as many Cuyahoga County residents as possible. And we'll continue to do that as long as we receive the vaccine to do so. The Cuyahoga County Board of Health continues to work through a list of about 7,000 eligible people that remain on our list for group phase 1A. And you'll recall that these are patient-facing healthcare workers not connected to hospitals, EMS, and developmentally disabled populations living in group homes. The Board of Developmental Disabilities, the County Board of Developmental Disabilities, tells us that there are 480 facilities serving the developmentally disabled across Cuyahoga County. That's a big number. And many of these individuals can't come to our large pods for vaccination. So our medical director, Dr. Heidi Gullett, and a mobile team of doctors that she's coordinating have gone to these locations, many of them to begin vaccinating our developmentally disabled populations. We're also working with the Department of Developmental Disabilities and MetroHealth to do some small pods for those that can come to get vaccinated, to do a bit larger groups where we can do it safely. And MetroHealth will assist us with working through these large number of group homes in the community. So we're grateful for their support. And that's also supported with resources from the county executive and county council. So we appreciate their continued support in this pandemic to vaccinate the vulnerable populations. Given the size of the population that remains under phase 1A, that's the 7,000 people at least on our list, we'll continue to see overlap between phase 1A and phase 1A, or excuse me, phase 1A and phase 1B, which has begun in the near term. We'll continue to see an overlap between those two phases. Last week, we know that the Ohio Department of Health posted information on all the providers in Cuyahoga County that are dispensing vaccine in phase 1B of the Ohio vaccination campaign. And that provider list will continue to grow as more providers are approved by the state. The list includes federally qualified health centers, home health providers that may be serving people who are homebound, as well as hospitals and select pharmacies. The list currently contains over 80 providers from across the county that will distribute about 15,000 doses of COVID-19 vaccine each week to these senior populations until as long as the vaccine supplies continue, and we think they'll continue about at that rate in the near term. And we know that they will become more plentiful in some weeks to come. But we still are in this period right now in the near term where we'll see somewhere in the order of 15,000 doses per week across the county for seniors. The Board of Health posted our own version on our homepage that offers a localized view of these providers and how to reach them. And the list can also be found, if all you have to do is click on our homepage and you'll see a link right away that talks about vaccinations for seniors in the phase 1B range. We know the demand, as Executive Budish noted, far outweighs the current supply. And there are about 100,000 doses being distributed each week for phase 1B providers across Ohio. We're urging your continued patience as providers work to vaccinate eligible individuals in the coming weeks. What we're doing is really building the infrastructure with these providers to be able to surge as more vaccine comes forward so that people can go around the corner to get vaccinated, connect with their doctor, go where they go to their pharmacy to get their prescriptions, come to the health department or to a community health center. And they have access is more widely available and equitable across the county as vaccine numbers and volume continue to grow in the coming weeks. All those who are eligible and wish to be vaccinated in phase 1B will need to directly contact these providers to schedule a vaccine. And Executive Budish described the process that 211 will assist us with in working through that. Phone numbers and web links on our website are available also to call these providers to schedule a vaccination. If you've already pre-registered with phase 1B on our ccbh.net/vax, that's ccbh.net/vax website, you still need to contact these other providers, or you can wait for a slot to come open for an event that we have when we begin our 1B group, which will be sometime next week when we receive our first round of 1B vaccine. We want to provide a reminder of the 1B rollout over the next few weeks that really began on January 19th with our seniors over age 80, age 80 and over. January 25th, we'll start with those 75 years of age and older with severe congenital or developmental disorders. February 1st for Ohioans 70 years of age and older, and employees of K through 12 schools for those that wish to return in-person hybrid or full in-person models. And finally, February 8th, those Ohioans over 65 years of age and older. We've noted that the most recent census estimates from last year tell us that there are about 230,000 seniors over age 65 in the county. So this is a very large group, and it's going to take some time to work through them, particularly in this current limited availability of doses of vaccine. So vaccine providers are urged to consider issues that may impact the ability of seniors to access vaccine. We'll continue to be working with senior adult services in the county and our senior centers, the Western Reserve Area Agency on Aging, the library system, and others, in addition to 211, to try to support our seniors. All providers are urged to eliminate barriers to healthcare access for vulnerable populations. These barriers include a lack of transportation, handicapped and accessible locations, lack of computer literacy or access, and employment that does not offer paid time off for medical appointments. When planning appointments or clinics, vaccine providers should consider strategies to negate potential barriers to access and help ensure vaccine availability for members of these vulnerable populations. Examples include offering flexibility in scheduling appointments, advertising clinic information on print materials to display at libraries, grocery stores or faith-based organizations, partnering with churches, libraries, or community centers for clinics, partnering with ethnic media and trusted leaders to share information, and offering after-hours or weekend services, mobile vaccination services, or clinics that offer walk-in options. Also, they should ensure that identification requirements are used to verify name and date of birth, not the residence or immigration status. We also need to protect our seniors against scams or fraudulent attempts to access financial or other personal information under the guise of providing access to COVID-19 vaccine. So, a few important reminders. Don't get the first dose of vaccine if you're confirmed through testing to be positive for COVID, or if you're still sick with COVID symptoms. You must have finished your 10-day isolation period at a minimum and feeling healthy when you receive the vaccine, just as it would be if you were getting a flu shot. Each vaccine requires 2 doses. Pfizer type needs 21 days or more between doses. Moderna is 28 days or more between doses. You'll be given a card with information on the vaccine for your second dose. We encourage everyone to work with their vaccine provider that gives you your first dose and arranging your second dose at the proper interval. Your second dose must be the same manufacturer as your first dose. So if you get Pfizer vaccine for your first dose, you need Pfizer vaccine for your second dose. Same thing with Moderna. Moderna vaccine for your first dose, Moderna vaccine for your second dose. And each provider will identify a process for getting you your second dose. The typical side effects may include mild arm pain at the point of injection, headache, fatigue, or a slight fever that goes away in a day or so. Symptoms may be more pronounced after the second dose as our body is building the normal immune response. Not everybody will have symptoms, but if you're having those side effects, it indicates that your body's mounting a lasting immune response, which is a good thing. So talk with your doctor first if you have a history of allergies to vaccines or other bad reactions from vaccines. And remember, as Executive Budish said, continue to wear those masks. Wash hands and social distance. We've come too far to stop relying on those fundamentals. We need to do this for several more months as everyone gets vaccinated. We need to continue to protect each other. Lastly, before I transition to our director, Jana Rush, to provide the data brief, I wanted to thank the County Emergency Operations Center that is directed through Executive Budish's office. The folks there have been incredible from the beginning. I've had the pleasure of working with them for many years through many emergencies over the decades, and they work hand in glove with us, are there with logistics and support, and providing all of our needs, and with us in these 13-hour pods that we have outside in the cold with setup and breakdown to be addressing problems to improve flows through the clinics, to try and maximize our efficiencies, to make sure folks are fed, to make sure our equipment is connected so we're able to input the data into the systems, and to respond to phone calls from the public and basically be at our beck and call if we have a need. And that's a pretty remarkable thing. So I want to thank Executive Budish and the team at the Emergency Management Agency. They've been fabulous. So with that, I'd like to turn things over to our Director of Epidemiology, Surveillance, and Informatics, Jana Rush.
Good afternoon. Okay, so today I'll be covering our updated data for Cuyahoga County jurisdiction for this past week. So our total number of cases, we have over 57,000 cases that have been reported to date in the CCBA's jurisdiction. This is an increase from the previous week with slightly more than 3,500 cases reported this past week. And overall, our daily case volume has decreased by about 20%. So during January, we averaged about 400, we are currently averaging about 480 cases being reported per day. And this is a decrease from our daily average of where we were in December at over 600 cases being reported per day. So we have seen a drop overall in cases from December to January. For hospitalizations, we have over 3,400 hospitalizations that have been recorded to date. That's an additional 158 hospitalizations that have been reported over the past week. We've also seen a decrease in our hospitalizations as well over the past month by about 4%. For our deaths, we have 1,450 deaths that have occurred throughout the entire county. Approximately 70% of those deaths have occurred within the Board of Health jurisdiction. And on average, we're currently, during January, we're averaging about 6 deaths occurring per day throughout the county. 111 new deaths have been reported over this past week. That's a slight decrease from the previous week where we had 158 deaths were reported. And then overall, we've averaged about 16 deaths were occurring during the month of December. That's our highest since the pandemic has started. And that's 4 times what we saw or observed prior to the peak of our infections in November. So we definitely saw our deaths spike in December based on the case infection rates that increased significantly during November. Okay, we can go into the next section for the demographics. And so our demographics for our jurisdiction have remained fairly stable over the past quarter. So females in those aged 20 to 29 represent the largest proportion of our cases. Whites represent the largest number of our cases as far as race, followed by Blacks and those of Hispanic ethnicity. A quarter of our cases have a pre-existing condition, and about 10% of our cases are healthcare workers. We can go to the next section. And so here's our epi curve. So this is the trajectory of infections that happen according to illness onset date. And as you can see from our spike back in July, now that we're, towards the end of the year when that huge spike happened in November, as well as going into December, you can see that our epi curve, there's a lot of variation day to day in the number of case reports that we receive. But on average, we've been at about that 500, 600 cases per day level, but it can vary day to day pretty drastically. So you can kind of see that in some of the peaks and valleys that you see towards the end of the curve here. We can go to the next section. And so this is our zip code map. So it's the geographic distribution of our cases throughout the county. And this has also remained stable over the past quarter. There has not been a significant change in the distribution of cases geographically. You can go to the next section. Okay, so for our hospital utilization data, our critical care adult beds, that's also decreased slightly in the utilization. So we're at about 80% utilization with our critical care adult beds, and that's comparable to the levels that we saw approximately 4 weeks ago. And then our ventilator usage has also decreased. We've saw a 6% decrease from what we saw over the past month in ventilator usage throughout the county. Next section. And so our testing numbers. So our testing positivity rate has also decreased. It's decreased slightly from where we were the previous week. We were at almost 21%. Now we're currently at 16%. And this is even though we are still testing at similar numbers that we were testing back at the end of December. So we're still not seeing a significant drop here as far as that trend is leveled off slightly, but we're still having high level of positivity rate. And then for our nursing home positivity rate, that has remained unchanged compared to last week. So we've been at about 19% for our positivity rate. Back when we were at our peak for our cases in November, our positivity rate in the nursing home community was upwards of over 24% positivity rate. So that's where we currently are with our numbers. Overall, I would say, just to put our data into perspective, as I always try to end with, is that we must stay vigilant. Our infection rates are still relatively high. They have leveled off some, but we still are seeing a high level of infection within our community. As we move towards more vaccination within the population, as well as our continued public health measures with social distancing and mask wearing, we can be cautiously optimistic that our infection rates will continue to decline and improve over time, which is encouraging. So with that, I will end. So thank you. And if we have questions, we can turn that back over to the moderators. Thank you.
Thank you, Jenna, and thank you all for your updates. We now have a few minutes for questions. Please identify yourself and your organization, and please remain muted when you are not asking a question. So we will now take a question.
Hi there, this is Courtney with the Plain Dealer in Cleveland.com. I'm wondering, just to clarify, for the 211 plan for vaccination information. So the hotline operator will direct you, if you're not signed up with a specific hospital, they'll direct you to your primary care doctor or perhaps another location where vaccine is available. Do they forward your call directly to that place? And I guess what happens, what should callers do if the place they get linked up with initially doesn't have any more vaccine or doesn't have any time slots? Will they go back to the 211 line, or should they call back and reinitiate the process?
So the really important thing about the 211 system is that you'll have a warm voice and a warm body who can answer your questions, and that's very important. So as you said correctly, if a person is not affiliated with a hospital, if they don't have a primary care physician or FQHC, then they'll be referred to typically to one of the pharmacies that have vaccines. As I said, we have a GIS system that can locate the pharmacy, a pharmacy that's very close to the caller. They'll ask, where do you live? But they'll identify a pharmacy. They'll be doing their best to keep up with which pharmacies have vaccines. So hopefully they won't be referred to a pharmacy that's out of vaccines. They will be trying to keep up. If in fact, because of such scarcity that exists, they do call and find that the pharmacy does not have vaccine, they can call back, or they can call the Board of Health and get the information there. But the whole purpose is to be able to use a phone number. There are good websites out there. Both the county has a good website and the County Board of Health has a good website. But unfortunately, a lot of people, especially since we're dealing with seniors now, are not as adept at using websites. As you know, Courtney, there's probably 25 or 30% of people in Cuyahoga County that don't even have internet access. So we're doing our best to provide a central line that's easily accessible for everybody and that will have up-to-date information.
Gotcha. Thank you.
Sure.
And then kind of related to that, if people who call the line do eventually get directed to the Cleveland Health Department or the Board of Health to get on that wait list, I'm wondering if the Board of Health can speak to your guys' wait list is still just for 1B, right? Not subsequent groups?
Yes, Courtney. Right now, the state hasn't announced any subsequent groups beyond 1B. I think the sense is with 230,000 seniors out there over age 65, and we're still churning through 1A in a big urban county. And also we know there's something in the order of 22,000 adults working in schools that are part of 1B as well. And then also a number of folks that may have congenital issues or developmentally disabled populations that may be living in the community that are outside of the group homes that will be eligible. So there's still a lot of folks to churn through, and the state hasn't announced that yet. And I think we're going to need some time here to work through this very large group. I think the important thing to note is that these are the most vulnerable folks that we've been focusing on. We want to get kids back in school. We think that's very important, and we've had to make some difficult decisions, families, or agencies over the many months. But getting kids back in school for socialization, for connecting to friends, for getting back a sound education plan, all those things are wonderful. And taking care of our seniors, what could be more important? They are most likely to have complications, or where we certainly see all our fatalities. So we're going to take the time to reach these folks in these months ahead. And then we'll hear from the state more as we go forward on what the subsequent phases will be and who will be next.
The real difficulty here is the lack of enough vaccines. It is so frustrating. It's frustrating to me. It's frustrating to Terry. I've spoken to the governor. It's frustrating for him. It's the federal government that has to get us the vaccines, and right now there's just not enough out there. So we gotta get more.
Thank you.
Thanks, Courtney. Any other questions? Okay, well, thank you, Courtney, for your questions. Appreciate it. That concludes today's press briefing. Thank you for joining, and have a good weekend. Take care.
Thank you.
So sad to hear of Scott's brother.
Yes, it really is.
I sent him a text. I truly understand how he
Sweeney's here.
feels.
Good morning, Marty.
Good morning, Dale. We're just getting my laptop up and running right now. That's why I'm on my phone. Excuse me, Mr. County Councilman.
Okay.
Good morning, Marty. Welcome.
Thank you.
Joe, we are live on YouTube, so I guess whenever you and Janine are ready, I guess you guys can go ahead and start.
Janine, are we ready to go?
Good morning, Dale. Good morning, everyone. Yes, you do have a quorum.
Okay, well, we all know the sadness, the passing of Scott's brother Jeff overnight, and as a result, as vice chairman, I'm going to run the meeting this morning, and I'm going to ask the clerk to please call the roll.
Calling the roll, Mr. Miller,
Here.
Ms. Conwell,
Present.
Ms. Baker,
Here.
Mr. Sweeney.
Present.
There is a quorum. Also, as you just noted, Councilman Miller, Mr. Tuma is absent from the meeting today, and Mr. Jones is also in attendance.
Okay, thank you, Council President, for joining us. And has anybody signed in for public comment?
No, Mr. Chair, no one is signed in.
Okay, thank you very much. And at this point, I would like to ask everybody for a moment of silence to offer our condolences on the passing of Scott's brother, and also we can reflect good thoughts for our country on the transition of national leadership. Thank you very much, everybody. And item number 4 on the agenda is approval of the minutes for the December 2nd, 2020 meeting of the Public Works Committee. Do I have a motion relative to those minutes?
So moved.
Is there-
Second, Conwell.
Okay, thank you very much. We have a motion from Councilwoman Baker and a second from Councilwoman Conwell to approve the minutes for December 2nd as presented. Is there any discussion? Hearing none, all those in favor say aye.
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 Any opposed? Okay, the minutes for December 2nd are unanimously approved. And we go to item number 5 on the agenda, which is matters referred to committee, of which we have a sizable number. And the first item is resolution 2021-0002. So I would ask the clerk to please read that into the record.
Resolution number 2021-0002, approving the MetroHealth system's policies and procedures to participate in one or more joint purchasing associations.
Thank you very much. This is a routine resolution that we have to pass every year on behalf of MetroHealth's purchasing. I believe we have either Mike Tobin or Justin Gallo from Metro to speak on behalf of that. Is this correct?
Correct, Council. This is Justin Gallo from the MetroHealth.
Okay, please proceed.
Yeah, so in order with the resolution, the MetroHealth system asked for permission to proceed forward in using group purchasing organizations on behest and benefit of the county and procurement policy.
Okay, are there any questions by any of my colleagues? Hearing none, we're already into 2021, so I think a passage on second reading suspension would be in order. Is there a motion to make that recommendation?
So moved to the recommendation.
Second, Conwell.
It's been moved and seconded by Ms. Baker and Ms. Conwell to move resolution 2021-0002 to the full council with recommendation for passage on second reading suspension. Is there any further discussion? Hearing none, all those in favor say aye.
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 Any opposed? Hearing none, the resolution is so recommended, and we go on to resolution 2021-0010.
Resolution number 2021-0010, declaring that public convenience and welfare requires resurfacing of various avenues, boulevards, roads, and streets located in various municipalities in connection with the 2021-2022 50/50 resurfacing program.
Good morning, Nicole English with Public Works. So
Good
this
morning.
first item, the first item is our 50/50 program awards for 21 and 22. Normally we'll do a year at a time. We select 2 years at one time, but we present them as council at one. But because we're kind of lagging behind, we wanted to just present both 21 and 22 together so the cities can be made aware of their awards and they can start planning for their projects. So this is our typical 50/50 program where the cities had applied for projects. They will design the project and they will construct the project. We will contribute 50% up to a maximum of $250,000 per project, and based on what they asked for. So some projects, if they're under 500, they may be getting awarded a little bit less than $250,000. But in general, most of them have projects over 500, so they're getting the maximum award of $250,000. I've provided a spreadsheet and a map to make it easier for you to be able to see where the projects are, the project limits, the municipalities that they're in, and their project costs. I'm happy to answer any questions on any of the projects or the program in general.
Thank you very much, Ms. English. Do we have any questions by any of my colleagues?
Mr. Chairman?
Yeah.
Martin Sweeney.
Councilman Sweeney.
Thank you, Mr. Chairman. Ms. English, I'm just trying to figure out, I'm new on this, so I might have some redundant questions. The selection process, can you tell me a little bit about the submissions, and is there a ranking, and how long the dollars will stay in place in case the project doesn't move forward in a 2-year period? And a Cliff Note version, and if not, I'd like to have the opportunity to come sit with you, understand a little more intimately, and not take all the time up on educating myself right now. Thank you, Mr. Chairman.
Sure. We can be quick today, and then we're happy to follow up with you. We have kind of a package of all of our road and bridge programs that we take out to cities, and we've met with different council people when they come in. So we're happy to meet with you and go through all of our programs. But real quick, the 50/50s, the cities apply for these. So fall, I want to say, or last summer, we put out a request to every city. They send in projects that they would like to be scored. We score all the projects. They're mainly scored based on average daily traffic. So the more traffic, the higher points they get. Pavement condition rating. So the worse the pavement, the more points they'll get. We use an economic health score, which is similar to what DOPWIC or Issue 1 uses. That's tied to poverty level in the city and average income in the city. And then there is a score if they've gotten a project recently in the past from the county through this program. So if they've had a project in the last year, they get less points than if they haven't had one in the last 5 years. So then we rank, and then we have approximately $2.5 million a year that we put into this program. So this is an award just over $5 million total. So for the 2 years, we're awarding this amount. And then there is a limit for one project per city per year. So you won't see, a city on here for more than one project in a year either. And then as far as how long they have to use the money, we award it for 21 and 22. However, we work with the cities. If they call us and say, hey, we're really not going to get to it till 23, we had some budget problems, we hold the money for them. It's not that we give it away. We've even had cases where they can't get the funding together for that project and they come back and ask for a change. We'll evaluate that and make sure it's still a worthy project and then present that back to council if a change is asked for. So we work pretty close with the cities on these to make sure that they can, utilize the money we award them.
Thank you. And Mr. Chairman, to my colleagues, I appreciate the flexibility to understand that I just see one project from the city of Brooklyn, and I look forward to sitting with you and having more of an intimate understanding, but I wanted to be able to get back to the mayor over there and tell her what's happening, and you gave me the opportunity to understand a little bit better. Thank you, Mr. Chairman.
Any other questions?
I have one, Chair, if you don't mind.
Yes, Ms. Baker?
The 5 million that you mentioned, has there been an increase at all over the years? Is 5 million, in your opinion, adequate? What are your thoughts on that?
It was 2 million, and then we raised it to 2.5 a year when we got the increase in license tax fees for 2019. So we did increase the program. This program is kind of nice because it spreads the wealth around, but 250,000 isn't a ton for cities to use. So we increased it to make sure we could get a couple more projects a year, but we do see a bigger impact when we put some extra money into those operations projects, because you can get some bigger projects done over there. So I think the funding is pretty adequate. I mean, you see 22 projects we're going to do over 2 years. I want to say there was about 15 that didn't get funded, so we funded more than half that came in. So I think it's a pretty good number for right now.
So if I may, so the vehicle increase that we did has a direct impact on these projects.
Exactly. Yeah, $500,000 a year.
Good. Thank you.
So, Ms. English, can you tell us what determines whether projects are done under this 50-50 program or whether they're done like these other resolutions that we have coming up later on the agenda that are typically 80-20?
In general, these projects are smaller, so you'll see the total cost is, should be around $500,000. Sometimes the city needs to fill a funding gap if they do have federal money involved, and so they just are missing a little piece that they come to us with for the 50-50. But the cities really determine if they want to go after this 50-50 money. We also tell them it's better for smaller roads that aren't major thoroughfare county roads, because we really wouldn't look to do an operations project on something that maybe only has a couple thousand vehicles on it in general. So the 50-50 program is kind of like the next lower tier roads versus the operations jobs. Operations are bigger roads, more highly traveled in general, maybe have a couple 4 lanes, 3 lanes, opposed to just a 2-lane local road. It's, the cities do apply, so they could apply for any road. It's not that they can only apply for those roads, but that's what we, in our package of information on our road programs, it's kind of how we steer cities, that these 50-50 jobs are really for, more of your local, smaller projects, maybe shorter stretches of projects.
And Ms. English, how soon are we planning on starting construction on the 2021 projects on this list?
Some of the cities are going to be ready to go in the spring. That's why our hope is to try to get these passed. They were delayed a bit at the end of last year. So we would ask for second reading suspension so that the cities, we can get legislation to them. They can get it passed and feel comfortable when they bid their project that they have our money to do the project.
Are there any other questions by my colleagues?
Nope.
Hearing none, is there a motion to recommend for second reading suspension?
Make that motion to recommend.
Second.
Been moved and seconded. Was the second from Sweeney?
Yes, sir.
Okay, great. So we had Ms. Baker first and Marty Sweeney second. Thank you very much, colleagues. And all those in favor say aye.